So what this provides you is a default plan of action that can be used reliably in most clinical situations. Obviously, again, we customize this per patient and per clinical situation. Here's another way of visualizing these major components. Again, food and nutrition, infection and dysbiosis, nutritional immunomodulation, dysmetabolism, and dysfunctional mitochondria. The acronym for those four categories is FIND. Then we move to style of living, psychology, sociology, sweat as a metaphor for exercise, stress, sleep, special considerations with supplementation, and those special considerations can also include surgery. Then we look at endocrine function and balance and also xenobiotic load. So style of living and most of those special considerations start with S, then we go to E for endocrine, and X for xenobiotics. So that's SEX, so the complete acronym is FIND-SEX. That's easy to memorize, but not necessarily an acronym that you would want to write in your patient chart notes. So in category number 7 here, you can change the X for a T and just call them toxins, and you are looking for a set of problems and a set of solutions. Again, FIND-SEX or FIND-SET. Food infection, nutritional immunomodulation, dysfunctional metabolism, stress and style of living, endocrine imbalances, toxins, and xenobiotics. So we're going to add this on to our way of managing and medicalizing these patients. If a patient needs drugs, they need drugs. But at the very least, we also need to address their diet, lifestyle, hormone imbalances, and toxic exposures. So let's start now by looking at food, diet, nutrition, and lifestyle. So for example, in American medical schools, we commonly use what's called a SOAP note, and that SOAP stands for subjective, which is the patient's concerns and complaints. Objective are our clinical findings, assessment and diagnoses, and plan, which includes treatments, tests, referral, and follow-up. And what I'm proposing here is that in addition to our regular clinical routine of subjective, objective, assessment, and plan, that we simply add on a more detailed plan that includes addressing food, infection and dysbiosis, nutritional immunomodulation, dysfunctional mitochondria, stress, sleep, and style of living, endocrine and hormonal problems, as well as any toxic or xenobiotic exposures. And you can see that perfectly demonstrated in the amended SOAP note that I've shown on this page. So now let's see how to apply this in clinical practice. First of all, we have to appreciate that diet indeed induces systemic inflammation. So this was a radical idea, say 20 years ago, when my friend David Seaman wrote this article, The Diet-Induced Pro-Inflammatory State. Now, this knowledge should be pretty widespread that diet does indeed contribute to sustained or chronic inflammation. So if a pro-inflammatory diet is the problem, then obviously the solution is an anti-inflammatory diet, which I've defined here as a 5-part nutrition protocol, which I call the supplemented Paleo-Mediterranean diet.